大家好，这里是新疆湖拼客网名师访谈栏目。今天我们有幸请到我们头荐骨治疗界的大师 Polo 老师参与我们的节目。我们 Polo 老师毕业于盛名的美国普林斯顿大学，2002年他获得了头荐骨治疗资格证书。2002年在搬回意大利之后，Polo 老师开始以头荐骨疗法作为自己的主要治疗手法，开始在意大利授课。很快，其他国家纷纷邀请他前去授课。2003年，他的大型治疗中心在意大利的博洛尼亚开业，他投身于教授这种高效的方法，并且创立了意大利头荐骨学校的专业协会。2010年，巨海自豪地将头荐骨疗法引入中国。这种疗法帮助世界各国人民预疗身体的疾病、情绪的创伤、意外的事故、压力、疼痛、学习障碍、关系问题、出生创伤以及其他情绪上、身体上以及脑部的创伤、局限性以及痛苦。这种疗法已经使世界各国人民受益。下面呢，我们就有请我们巨海公司的曾总来介绍一下我们巨海公司。
大家好，我是巨海公司的董事长曾春生，很高兴今天这个受新疆湖拼客网的这种一个采访，我来介绍一下巨海公司。巨海公司成立于2006年的6月份，到今天为止整整是7年的时间。那当初成立这家公司的初衷是，我通过观察和发现，我们中国改革开放30多年，我们的 GDP 不断的提升，我们的生活水平也得到大幅的提升，但是在经济快速发展、社会快速进步的同时，我也观察到一个现象，就是我们的人的幸福指数并没有得到很好的提升。我们通过观察发现，我们的家庭关系、夫妻关系、孩子关系、父母关系、兄妹关系、同事关系、朋友关系，还有我们的合作伙伴关系，在这个高速发展的经济时代，我们在努力的拼搏、努力的奋斗的同时，我们忽略了我们所有的拼搏的核心目的是追求幸福和快乐。当然，通过观察，当我们发现通过努力和拼搏以后，很多优秀的企业家、很多优秀的商人、很多优秀的社会工作者、很多优秀的社会人士，并没有真正的实现他们的幸福。那巨海公司成立的初衷，就是想如何的去支持到我们的国人去实现幸福的梦想。为此，在成立直到现在7年的时间，我们不断的去发展并定位打造中国心智成长第一品牌，支持1亿人实现幸福梦想为愿景这个社会责任和使命。我们请了国内国外的这些名师专家，让我们实现幸福的梦想。因此在这几年的发展过程中，巨海公司先后在深圳、广州、东莞、长沙、西安等地成立了分公司，而且我们邀请到国际上和国内的很多的名师，例如我们的 Rose 老师、Polo、John， 包括海灵格等等一些国际上的名师，包括亚洲的名师周鼎文老师，及我们国内的雷鸣老师、雨仁老师、叶小米老师、胡一然老师等等一些名师，来支持我们一些企业和企业家们在他们获得财富上的自由的时候，更好的获得身心健康的这种自由，让我们更加的幸福的生活。为此，公司在这么多年的业务开展过程中，我们服务的客户接近有3万多家。可以说，通过这么多年的发展，我们内心更深处的感觉到，通过学习 通过名师的指点和这个支持，这些企业家、这些学员改变了自己的命运，也让自己的家庭关系、夫妻关系和孩子的关系及跟父母的关系、合作伙伴的关系得到了很大的一个改善。我认为这是我们巨海公司非常值得骄傲的一件事情。我们公司有一个使命，叫支持企业家快速的成长，打造卓越的人生，为构建和谐社会而努力奋斗。那这个使命从一开始到现在根植在我们每一个巨海人、每一个巨海的学员的身体和心灵上。所以说巨海今天不光是我们巨海100多员工身上流淌着这个使命，包括我们3万多学员，他们也流淌着这个使命，去支持更多的人幸福。那2010年我们非常荣幸的又请到了我们国际上著名的头肩骨治疗专家 Polo 和 John。 那 Polo 老师，那前期我们也有一些介绍，可以说是从他身上你就能看到、能感受到什么叫幸福。他身体力行，包括他的一些工作的支持人的能力和一些方式。头肩骨就像我们中国的这个中医一样的，我们中医是叫这个指压，或者说我们这个身体疗法，但头肩骨呢，从身心灵气、身心这种疗法，可以说通过学习，很多学员受益非常大。所以呢，我在这里呢，我们非常的感谢这个 Polo 老师，还要感谢我们其他的所有的老师，并且我相信巨海在未来的发展的过程中，我们一直在中国市场乃至未来的亚洲市场定位是中国做心智成长这个品牌，推动人们的身心灵健康。我想这是我们所有人的核心的追求的最终的方向。再次感谢所有各界社会的朋友的对巨海的7年以来的不离不弃支持。同时我也非常感谢这个新江湖拼客网的名师的访谈的栏目的今天呢能来到我们公司跟我们做一个很好的一个交流。那非常感谢，我们也祝贺我们的新江湖发展的越来越好，把我们好的知识、好的信息传递给社会更多需要得到更好幸福的人们。谢谢大家。
Hi, Polo. Welcome to our program. And I want to ask you first, can you tell us what is craniosacral therapy about?
So, well, first of all, thank you, Walter, for taking the time to interview me, and I'm really happy to be here with you and the people watching us on the web to share about the craniosacral therapy. So, your question is, what is craniosacral therapy about? And I guess the first few things that I can say about craniosacral therapy is that it involves 3 main areas of work. And the 3 main areas of work that we're concerned with is the work that we do with our heart, the work that we do with our fluids, and the work that we do with the central nervous system. So basically the craniosacral therapy is a hands-on approach, so it's something that we do with the hands, and it's about the establishing a relationship with the client that has certain healing elements in it, and through this type of touch you're working on different aspects of the person's life, and the 3 aspects would be the heart, the fluids, and the central nervous system. So, if you want, I can be a little bit more specific.
Yeah. So can you share us what about the heart?
So, the idea of craniosacral therapy is that the heart is the center of our life. we're living a heart-centered life. Each one of us is driven by the heart in the life choices. But the latest discoveries around the heart show that the heart is not just the pump of the blood, but the heart in our lives is also the center of our emotional life, of our relational life. And furthermore, we've discovered the relationship that our heart has to our overall well-being and health. So in a way, our overall well-being, our own healing power, the self-healing power that we've heard so much talking about in this period, the self-healing power is really under the command of the heart. I think you can understand that from Chinese medicine, right?
Yeah.
Yeah. So the heart is in Chinese traditional Chinese medicine, you consider the heart to be the emperor of the body.
Yes.
And I like to think of it sometimes as, if it's a woman, then I like to think of it as the empress. Yeah. And the idea is it's much more than just a blood pump or an organ of relationship, but it's also an organ that maintains health.
Yeah.
So the way we work craniosacrally is a way that is designed to re-establish a sense of coherence in the heart field. So it's the central part of it is working with the heart. And then there's other aspects that I was mentioning about the craniosacral therapy.
Oh, yeah. Yeah, it's very interesting.
Yeah.
And I'm wondering, how did you get interested in craniosacral therapy?
Well, I think that's a huge question actually, and the question for anybody is how do you get interested in the path that you have chosen in life?
Yeah.
And I think that it's a question that as you ask it, I can feel it tap into my own life history, and I think very much of it has to do with my own suffering. So I think what has driven me in my healing journey is the experience of my own suffering and the desire to resolve the suffering. So I think the big driving force for me has been to recognize that I was living a life of imbalance, of stress, but also inner difficulty, both psychologically and existentially. I felt like life wasn't as fulfilling as it could be. So there was a great deal of pain. And I've come across different healing methods. So, ranging from massage to energy work to psychotherapy, psychology, and counseling, and I've had extensive experiences in all these fields. And I got interested in craniosacral therapy because in it I could find a level of healing and a resolution of, my heart experience. And as I was saying before, there's really three elements that we're concerned about in craniosacral therapy. So the heart, the fluids, and the central nervous system, which I might tell you more about. But I could feel in craniosacral therapy that there was a quality of gentleness that I very much needed in my life. The way I've grown up and the life experiences which I've had have made it so that a gentle therapy, a gentle and really respectful approach actually helps me to open up much more than the other approaches I've experienced. So.
Yeah. And where did you study craniosacral therapy? And how did you grow up?
So, well, I guess that's two very different questions. One is, where do I grow up? I was born in the Philippines, and my mother is Swedish, and my father is Italian, so I have already a mixed background. And so, an Italian father, a Swedish mother living in the Philippines, that's already speaking very much about integration. My life experience, I think, from the base is about integration. And of course, all this is also confusing. So I think my drive in life has been that of finding a sense of coherence, a sense of belonging. You know. And so I grew up in the Philippines and South America, where my brother was born, and I studied in the United States. I studied molecular biology in one of the greatest universities in the States. So I have a science background, and the science background has been the kind of the formative aspect of my life. And with that science background, I've approached the world of healing, and it's been turning out to be much more than science. It's become a lot about the heart and the deeper aspects of the spirit and of the self. So the second part of your question was, what about my craniosacral education? So I guess some of it started already in the States. So when I was doing my healing school, I was studying as a massage therapist in a Japanese method of therapy, and I was studying Chinese medicine at the time, and I had the luck of having teachers which also were craniosacral therapists. So we received, as part of the training in the US and California, a basis of practice in craniosacral therapy, and I just could feel a quality completely different from massage or body work, and a quality completely different in the listening that I was being given while I was receiving the craniosacral session. So I got interested in the States, and then I furthered my training in Italy, where there's some actually really good teachers in Italy. And so I studied in Rome with the Institute of Craniosacral Therapy of Rome. And then I got also interested in some English teachers like Michael Kern. And Michael, I think I owe a lot to Michael Kern in terms of the experience of being his student and being healed by being in his courses, and the kind of support that I received from the craniosacral environment has been so fundamental. I mean, I feel like it's helped me grow up as a person through the courses and the relationship that was demanded by my teacher in the courses. I feel like I've become an adult. I can feel I've really grown up. And I, together with Michael Kern, I've met other people like Shea or Franklin Sills. Franklin Sills is actually one of the founders of the biodynamic method, which is the current of craniosacral therapy that I'm teaching these days. So I think the craniosacral has been a learning process. I feel like I'm still learning in a way, very much from my clients. But I would say the experience has been mostly in the US and Italy and England.
Yeah. So I heard you mentioned Chinese medicine several times. So do you have some idea about Chinese medicine and craniosacral therapy?
Yeah. It's a good question. I think I feel excited about being here because, in a way, I think the West has made such a great evolution with the scientific and traditional medicine, and it's a type of medicine that definitely saves lives. I think a traditional Western doctor is a really good, how do you say? They're really good at cutting, opening, fixing, and
surgery.
The surgery,
Yeah.
right? And I think of the greatest strength maybe of the Western medicine is the tailoring work that they do. Like the tailor that is able to disassemble and reassemble the body.
Yeah.
So I think that the Western approach is very great, but your own Chinese tradition of energy work and understanding of the energy is actually a really profound and wonderful understanding of life. So through my own experience of traditional Chinese medicine, I've come to understand some of its underlying principles of balance, you know, like the yin and yang, the breathing in and the breathing out the principle of, you know, the flow of the elements, you know, and the principle that health is connected to a sense of free flow. And we, you know, I think that's very similar to what we talk about in craniosacral therapy. And in a way, you know, the Chinese doctor is, you know, is listening to your pulse through this simple action. You know, the Chinese doctor is feeling all the kinds of qualities that are present in your fluids. You know, and as a craniosacral therapist, maybe, you know, just by holding your hand and tuning into your fluid system, which I can do just holding your hand simply like this, or your head or your shoulder, I'm beginning to feel the quality of the movement of the fluids in your body. So I'm starting to feel the quality of the movement of the energy in the body. Yeah, and so it's very similar. I'm picking up similar qualities, but in a different way. And you know, I think the beauty about the craniosacral system is that it's also somehow a simple and a more modern system that has a lot of grounding in modern research and modern science. So it's like, I think a lot of the Chinese people or Chinese doctors will find interesting ways of connecting the Chinese medicine and the craniosacral therapy. They'll find that it's not either the one or the other, but they'll find that, you know, the experience is an experience of integration.
So, is that one of the reasons you come to China to teach craniotherapy?
I guess, you know, I've been studying Chinese medicine for quite a number of years. I think, you know, I started studying Chinese medicine more than 14 years ago. 14, 15 years, actually it's 15 years ago. So, and, you know, I've been trying to understand and, you know, come into the system slowly over the years, and it's been very interesting for me to come here and also, you know, share my knowledge, but also to gain deeper knowledge and deeper understanding. So now it's been 4 years I've been coming here to China, and I have to say the experience is getting richer each time, and I'm making deeper and deeper connections between this wonderful healing method that we have developed in the West, that's been developed in the US and in England and in Europe, and I'm seeing the deeper connections to the medicine that you have here in China, and I'm seeing the wonderful bridge that could be created between traditional Chinese medicine, the huge wisdom and intelligence that Chinese people have as a birthright, you know, as a culture, and how this and this ancient knowledge can be connected in a modern way to modern man and a modern society. So, you know, my vision is that of a renewal of the old ways of transmitting the wisdom of Chinese medicine into something that is more useful. And I think the craniosacral therapy offers many keys for that to happen.
That's great. Yeah. So you have taught craniosacral therapy for 3 years in China. 3 years.
Well, yeah, actually, I think it's 3 years. It feels like 4 because you know, it's been trips over 4 years. I guess I came in 2010, 2011, 2012, and now it's 2013. So, you know, I feel it's been a growing relationship. You know, it's been interesting. It's you know, in some ways it's been harder than I thought in the beginning. But you know, as I'm understanding the Chinese culture better, and I'm understanding the wonderful qualities and also the history of Chinese people, I'm finding the way in which this therapy very concretely can support the modern Chinese man. So I feel like a lot of the work that I'm doing nowadays is not a work that's coming out of some nice therapy or some nice thought or some nice philosophy, but is very much rooted in the direct experience that I have of the, you know, the Chinese man or the Chinese woman today. I've been really getting close to Chinese friends and people and colleagues over these years. So I feel like I've gained a rich network and experience that has influenced my teaching and has informed it and made it deeper during the years.
Yeah. So you really enjoy the experience in China.
Yeah, I have to say I really enjoy it. When I'm coming here, it's in Shenzhen now. I've been in Guangzhou and I've traveled a little bit of China, and in a way it feels like coming home. So I have a homey feeling, and I have a sense of familiarity with my students and my assistants and my colleagues. So I enjoy it, and I enjoy being in China, and I think there's some wonderful things that as Westerners we can learn from China, and also as Chinese we have. I think you as a country have so much to gain for your own strength, power, success, and especially for your own happiness by looking at the West and integrating that in your own country.
And now I'm very interested in other aspects of craniosacral therapy. You mentioned there are 3 aspects, and you said about heart. What about the fluid?
Yeah. Well, your question is about the fluids. And in craniosacral therapy, we consider our body to be essentially a fluid body. So when we talk about the body, we're talking about its wholeness as a fluid body. And in a way, that's a metaphor for the body. So anytime we're saying we're healing the fluid body, craniosacrally, what we mean is that we're working with the body. And it's, the concept is we're actually made mostly of fluid. Some researchers say that we're made of as much as 80% fluid.
Yeah.
So that means that, in our body we have many different kinds of fluid. We have the blood and the lymph. We have cerebrospinal fluid, the fluid inside of the cells, and fluid outside of the cells. So our life system is a system that depends on the quality of the fluid flow. So an important aspect of health in the craniosacral system is the quality with which the fluids flow in our body. So one way that we could think about this is that the fluid is the most essential part of life. Anytime we want to see if there's life somewhere, if we want to look for life on another planet, what we're looking for is if there's fluid there.
Yeah.
So the idea is that you will have health in the body if the fluids circulating in the core are in a flowing exchange with the fluids circulating in the periphery. And the idea is that there's different kinds and levels of fluid flow in the body, and the more free this exchange of fluid is able to happen, the more free the rhythms and the pulsations of this flow is able to happen in the body, the more health there will be. Now, a lot of people, when they hear talking about the fluids, they think, oh, but I have a problem with a muscle, or I have a problem with a joint, and how does it help my back, or how does it help my brain, how does it help my organs? And the first thing that I want to reflect is that the muscle is mostly made of fluid. So the muscle and the organs and the joints themselves have a lot of fluid. Even if you think about your own spine or the joint of your wrist or of your arm, there's so much fluid between the bones, and the bones themselves have a great amount of fluid in them. So working with the fluid body means working with the ability for these pulsations and these flows of fluid to happen freely. And fluid is the carrier of life, is the carrier of nutrients to the body. And in a way, we could even say, you don't have to believe in energy to do craniosacral therapy. I think it just becomes really apparent that there is energy in the body. And wherever the energy is able to flow freely, then the fluid is able to flow freely. the working with the fluid is a way of working with the physical body. So, we see the bones and the tissues and the organs and the brain as something that is floating in fluid. So we very much see all these different body structures, these solid body structures, as something that is embedded in fluid. It's floating in fluid. So if a body structure is held rigid as a result of stress or trauma, then its ability to exchange fluids with the environment, its ability to be social in the fluid exchange is reduced. And as a result of that tension, you're going to have the basis for disease. So in that sense, working with the fluid body in a craniosacral way allows you to work with every part of the body. There's nothing specific about the cranium and the sacrum. What I want to say also about the work with the fluid body is that it's not just about the work with the cranium or the sacrum. The craniosacral therapy, working with the fluid body, really works with every bit and every part of the body, because every part of the body is made of fluid, and in every part of the body the disease that arises as a result of an impeded or a reduced fluid flow can happen in any part of the body. So any part of the body where there's been stress or shock or trauma, or that somehow has become sick, can benefit from the craniosacral therapy, because the therapy will work to re-establish the free flow of fluid, and as a result of that, the self-healing power of the body will be activated.
Yeah, and now I really want to know about the third main topic of the craniosacral therapy, which is central nervous system. So can you talk about it?
So your question is about the central nervous system, and we could say that the craniosacral therapy, especially the biodynamic approach, which I'm teaching here in China and which I've learned, has the center of its focus the heart, and the heart influences, and it's in a dynamic relationship with the fluids of the body, and it's in a dynamic relationship with the brain. So when we're talking about the central nervous system, we're talking about the brain, the spinal cord, and all the sensory nerves and the sense organs of the body. And it's a main topic of our trainings. I mean, these three aspects, I think in a way you can see them as organizing the entire person. Of course, the heart is here, in the chest, and it organizes the whole body. I mean, the heart field expands in the whole body. And the same way, the fluids, of course, I'm talking about the fluid body, so of course it's everywhere, but in a way the center of the fluid body is going to be somewhere around your belly, around your navel. And the central nervous system has its center around the head. So it's these three main areas. In Chinese tradition, you'd call them the three dantians. So it's three really sacred places of the body. And if you have a good relationship and a good connection between these three dantians, then you have health in the body. So the central nervous system is about working with the brain, is about working with your way of perceiving the world. I mean, the experience that you have right in this moment, as we're having this interview, or as somebody's watching this interview, the experience of the world that you're having in this moment is an experience which you're sensing through your central nervous system. And the central nervous system, of course, is made of nerves. We know it to be made of neurons, which are organized in a very complex way in our body. And the central nervous system basically functions in the core of our midline. So it's inside of the head and inside of the spinal column. And through the craniosacral work, we can treat and balance the function of the central nervous system. And our central nervous system becomes irritated. You know, it's like a processor of our experience. And a part of the big problem that we have with our central nervous system is that it gets irritated by the kinds of lives that we live, you know. So the stresses, the traumas of modern life really greatly affect the nervous system. The quality of the parenting that we've received, the quality of our early relationships in life, so the way that our heart has been met by other hearts influences the development of the central nervous system. What that means is that the quality of your life and the perception of the world that you have, the world that you imagine yourself to be in, the kind of mental picture that you have of yourself is produced somehow in your central nervous system. And if that system is irritated, or if that system is not functioning ideally with the balance and a connection to stillness and a sense of coherence, then your self-sense and the sense of the world and your sense of relationship to other people is going to be distorted. And so life is going to be intrinsically less satisfying. Mm-hmm. And until you get your brain in balance, then it's going to be impossible to perceive the world in its fullness and, you know, for what it really is. So, you know, in the craniosacral therapy, we're coming into relationship with the body and with the central nervous system through the skin in such a way that helps it to rebalance, to let go of part of its irritation, let go of its stress, so that it can start to function normally again. And, you know, as a result of that, I think you know, you're going to have a benefit not only in your perception of the world, but also in terms of your health, because, you know, we know the brain to be the largest gland. You can think of it as a gland in the body. So the brain is secreting all kinds of hormones and all kinds of substances in your bloodstream in very specific ways that help you maintain health and help you maintain balance. So, you know, the health of your brain is connected to the health of your heart, and influences greatly the quality of your ability to self-heal. So healing the brain and healing the heart are key aspects to re-establishing health in the body for problems that may not be at all connected to the brain and the heart. So,
as a therapy, I really want to know how this therapy be carried out. What is a session about practically? So can you talk about that?
Yeah, sure. So how is a session carried out practically in craniosacral therapy? I guess you know, what you're asking is, you know, what happens during a craniosacral session, you know, and what could somebody expect coming into the studio of a craniosacral therapist. And well, you know, one of the first things that I want to say about the way we work craniosacrally is that you know, this type of approach, the biodynamic approach, which is very different from the biomechanical approach. You know, I would say there's two main branches of craniosacral therapy. One is the biomechanic approach, which has been taught by Upledger and courses like that. It's a completely different way of coming into the contact of the biodynamic approach. I mean, my sense is, you know, the biodynamic approach includes biomechanics. So as my own experience, I started with a biomechanic approach, and I know how to use it, and I actually have taught it for a few years, and then I've learned also biodynamic principles that include that. So one of the key aspects of the therapy is that the therapist's own body and the quality with which the brain and the heart and the fluids of the therapist are functioning is key in influencing how the brain and the heart and the fluid body of the receiver is going to function. So a important and different starting point from the traditional massage or Chinese medicine is the awareness that the craniosacral therapy, the biodynamic approach in craniosacral therapy, really requires the therapist to have done a level of healing in their own heart. And it really requires that they have done some work, that they constantly do some work with their own mind and their own brain to de-stress it. And the reason for that is that craniosacral therapy works through a sort of resonance mechanism. We have discovered there's something called mirror neurons that make it so that between two people we can mirror states of the heart and we can mirror states of the central nervous system. So in a way, if we're spending time in a space together, and that space has certain qualities, which are the craniosacral qualities, like there is a sense of safety, there's a sense of trust, and a sense of warmth. If we're connecting in that space, then we're going to begin exchanging heart states. We're going to be exchanging mental states. And the idea is that maybe the person is coming in a really stressed or fragmented state of mind. It's been overworked, and maybe as a result it's having some health problems or energy problems or concentration problems, or the person is coming with a closed heart because life has just been so hard for them. When that person comes into the craniosacral space, so the room and the space that the craniosacral therapist has set up, they're coming into a very special kind of space. And in that space, the unique qualities of the therapist play a great role. So I think that's key in understanding what happens during a craniosacral therapy session, because besides the way that we speak or the technical things that we do during the therapy, a lot of it actually has to do with creating a bond and creating a real human heartfelt relationship with the therapist. So our biodynamic approach, obviously works also just in one session. You may benefit from it, but the greatest benefit and the deepest change that a person experiences is by creating the relationship with the therapist. From a practical standpoint, in a session you may come in and you most likely are going to have a dialogue with the therapist, which is going to be a therapeutic dialogue. The skills are the skills of counseling, so the dialogue has a certain technique to it, which is the counseling technique. We use a lot of the non-directive counseling technique developed by Carl Rogers and by the schools following Carl Rogers, and we refer a lot to Jerome Lees and other teachers, but it's basically an open dialogue and an open exchange to identify what is difficult in a person's life. And through that process, we're doing it in such a way that by telling the story and the way we're listening to the story is beginning to change the way the story is being told. So, you think if you're telling your problem to somebody that is listening to you with just a half ear, you're going to tell a different story from somebody that's giving you their undivided attention. And so you're telling the story maybe to a person on the bus that you don't know. It's going to be very different if you're telling it to somebody that you feel truly cares about you and is truly present in your life. So a part of the first part of the session is really about storytelling and story listening, and this happens in a special therapeutic way with the qualities of mindfulness and presence. The largest part of the session is actually spent during the table work. So the client may lie down on the table, in a comfortable environment, and the therapist is going to take some time to center themselves and coming into light contacts with all the different parts of the body. So the therapist may work from the head, which houses the central nervous system. It may work around the chest, the heart. It may work around the belly or the sacrum as a way of balancing those areas in the fluid body. But in a session, you would expect a really light touch. So you are not expecting the kind of touch that you have in massage, which is really a penetrating touch, so that the therapist is doing something to you. So it's changing or manipulating the state of your energy or your body. The craniosacral touch, the quality of it is it's so respectful. And really, more than about changing the person's body from the outside, the contact is allowing the person who's lying down to become mindful of their own state, to become mindful of their own body, fluid, tissue contractions, to become mindful of the kind of images or feelings that one is holding in the body. And so the touch is really the touch, and the way the therapist has been trained is so that the healing is happening from inside the patient towards the outside, rather than the typical work that we do in massage or in certain forms of dialogue therapy where the therapist is suggesting things to you. It's manipulating your body, or it's telling you that you should do certain things or others and giving advice. And in that sense, the body approach of craniosacral therapy is really about helping the person find, discover, and connect to the wisdom that's present in the body. And as a result of that, the body will open. So, if you have a typical session of an hour, maybe you'll spend 10 minutes, in the first part with the dialogue. You'll have about, maybe 40 minutes to really deepen into the healing process with really light hand contacts, which can be really everywhere in the body. I mean, we get really specific. We work with the small bones of the nose, and we may actually work with the bones inside of the mouth, and we may work with the throat or the spine, as part of the healing work. And what's so wonderful is that in order to heal a part of the body, say to heal the neck, I don't just need to treat the neck. I need to see how can I work with this person so that their energy increases, so that their own energy can support them in the healing process that's necessary for adjusting the neck. And what kind of stories and images and feelings are connected to the neck, like the lower back, may get locked, and what does that mean? I mean, is it just a mechanical, or is there more about it? And the craniosacral approach really allows the innate body wisdom to get activated through really light touch. And towards the end of the therapy, there'll be a moment of sharing, and the sharing is so important because it helps to integrate the experience, and it's also fundamental in the creating relationship. And we would have so much to say about how the craniosacral works through the relationship, but maybe we can do that at a later point.
Yeah, I'm very interested in how does it help with the relationship. So can you just talk about it?
Yeah, I could see you're lighting up as I was talking about relationship. I could see you got really curious about it. So there's different aspects to the work that we do regarding relationship. And a part of it, I guess, is we have to reflect on what influences the quality of our relationships. And I think one of the key aspects that sets the tone for our relationship quality and our relationship ability with the others, and the kind of tone that we have in relationship to the world, is set by our early experiences in life. So the relationships that we had early in life, the bonds that we formed early in our lives, set the underlying rhythm, the underlying tone, the underlying energy for all the other relationships that we form in our life. And it's, one way to imagine it is like, the early relationship that you have with your parents, so in the family system, in the family field, are like a crystal. And that crystal creates the base for the way in which the snowflake of your life structures. So each snowflake is different, and the information, the basic information about how that structure is going to be, is contained within that first crystal. And I think a part of the really wonderful work that we are doing in craniosacral therapy is recognizing that one of the key elements that we need as human beings in life, in our relationships in life, is the sense that we have a secure base. And one of the things that's most often missing in our early experiences is the sense of a secure base. And of course, the secure base has a really basic component to it. The fact of being sheltered by the storms and having enough food to eat and so on, which if are missing, can really have severe effects on the person's ability to trust life and to feel comfortable in life. But a lot of the times, in our relationship with the parents and with our primary caregivers, also as we grow up and as we go to school, these relationships perhaps don't have the kind of sensitivity, the kind of understanding that really helps us to feel secure in ourselves. And the ingredients actually to feel secure in oneself are actually very simple ingredients. But the fact that they're simple doesn't mean that they're easy to give. I think our parents have done the best they could, and I honestly feel that our parents in general, I'm not just talking about mine, but parents in general, do the best that they can. But sometimes the best is not enough. And so in life, we kind of walk in life with an incomplete development of our social abilities. We have an incomplete development of our relational abilities because some key ingredients have been missing. And as I was saying, the key ingredient, I think, the one of having a secure base in which you are mirrored by the parent in your feelings, in which the parent is connected to their own heart, to their own feelings, and is supporting you as a growing child to connect to your feelings, to be aware of them, and also to be able to experience them and express them in your own rhythm. So what I'm finding here in China is that very much like the West, we have a culture and we're growing up in a system where so much is demanded of us. So the love and the unconditional care and attention that we should be getting from our parents is being distorted because of the social need to perform. Sometimes for the parents it's so difficult to just love the child unconditionally. I don't care about what grades my child has in school, and whatever grades my child has, I love him and I trust him and I trust he's going to be that he's going to be successful in his own heart, in his own life. Very often this is just one of the many components that is missing. But instead the kind of condition that we're in is a condition where the kids are expected to perform in school even at really young age. They're really put in competition with one another, and so they lose connection to their needs. one loses connection to one's own feelings, to one's own body rhythms. And by losing connection to feeling and losing the connection to one's own body rhythms, one loses the connection to one's fundamental intelligence. And if you lose connection to your intelligence, you're not tapping into your ability to have intuition, to be truly creative, to be also simply at ease with yourself without performing. And so your life is driven in a kind of desire to be something or be somebody and to be successful, whereas your deeper happiness, which should be able to happen without anything, is actually something that you have never experienced, and probably your parents never experienced that. So in the craniosacral work, we're really focusing about establishing a healthy relationship with a healed practitioner, so that it's, in terms of relationship, your relationship with the therapist is working as a gym, and the ability that you gain in the therapy session then is going to be an ability which you're going to bring out into all the relationships of your life. And maybe one last thing I can say about this is that we're not only working with the present time, current time relationship with the therapist. As a part of our cranial work, a lot of what we're doing is to work with past stress and trauma. So we're working with the memories of past experiences. We're working also not only training the ability to be in relationship, but we're also working on letting go of the past pain and the past hurt, which we may be conscious or unconscious about.
Yeah, so you mentioned stress and trauma.
Yeah.
So how does craniosacral therapy helps with that?
That's a wonderful question. It's getting into one of my favorite topics about craniosacral therapy. So the topic is actually a really vast topic of craniosacral therapy, and I think a lot of the cranial work that we're doing nowadays borrows some of its skills from other fields of practice. So one I was mentioning before is, our cranial work is very much a kind of body connected therapy which follows the principles of non-directive counseling. So whereas the non-directive counseling is something that happens just through the words, trusting the innate intelligence of the person to emerge, we're doing the same with the body. And I think a part of the healing process for us is that we have to regain our ability to be present and mindful in our own bodies in addition to our own mind. And one of the results of stress and one of the results of past trauma is that we disconnect from our own body. So I would say the effect of trauma is that we are swept off our feet. We lose our sense of grounding, our sense of security, our sense of stability in life, and we shut down parts of our feeling. And maybe parts of our bodies shut down. So there's part of our body's intelligence that we cut ourselves off from when we experience difficult situations or shocking situations. So to get an idea of what may shock me, you can think of a moment where something happened to you that you really weren't expecting, or an event that happened in your life where you felt really scared. Okay, to some degree, that scary experience may have had an effect on you. You may be holding the effect of that scary experiences in your system, and the way you're holding them is either as a form of tension and rigidity, or as a form of disorganization. So your system gets either chaotic or it becomes rigid. Whereas what we're looking for, as I was saying in the beginning, we're looking for a nice sense of flow. So shock and trauma basically freeze parts of your energy. Parts of your energy and part of your feeling becomes rigid, and so you're less available to feel life, to be in relationship to life. And as a result, different organs or different body system may get in balance and will start to express disease. So the trauma work that we're doing, I mean, a lot of it is based on the work of Peter Levine, and we're doing a lot of work that is borrowing from the techniques of somatic experiencing, and we're using them in the cranial session, in the cranial work. The main aspect of it is to give the person a chance and a possibility to reconnect to their own traumatic stories and their own traumatic experiences in a non-mental way. So it's very different from analytical psychology or from an analytic psychotherapy. This is very much a body felt sense therapy. So you're not digging into your past for past childhood traumas, or you're not fishing for difficult past experiences. It's all very practical, very physical. The therapist is trained to feel the flow in the body. The therapist is trained to feel how your body is able to open, to connect to the therapist, which means to everybody else. How is it able to open up and feel the energy in the environment? So how open is it to receiving? And in feeling the openness, the therapist can also sense where is it closed, where is it tight. And where it's tight, you know that there's a story. Because in the therapeutic session, which is creating a secure base and a safe environment, there's no reason to express that full openness. The therapist is probably one of the most non-judging and mindful and present people that you encounter in your life. So the stuckness or the closeness that is present in your system is connected to some kind of story that your system hasn't been able to process yet. And that's what we call the effects of stress and the effect of trauma. So that we're creating an environment where those effects, those forces of tension or chaos can reorganize and eventually can be let go of. And the result will be the flow of health, the flow of energy, and the sense of enthusiasm in life, and so on.
Yeah, you talked about how does it help with the emotions and stress. So I'm wondering, maybe some people are very interested in about their body, their shoulders, their bellies. Yeah, maybe they have some problems about that. So can you share a little bit more about how does it help with our physical body?
Yes, sure. I mean, I imagine, people come with all kinds of different problems, which may be mental, may be emotional, or maybe physical problems. So let me say something more about this. So, a lot of people are actually going to come to craniosacral therapy for physical problems. And that may be a way that some clients are coming for therapy. I mean, in the West, craniosacral therapy is used in many different settings. But one of the aspects that people look for craniosacral therapy is relief from all kinds of physical problems. So, there's so many different problems that can be helped by craniosacral therapy, from the joints, the spine, physical inflammation of the shoulder, or an organ in the body which is not functioning properly, like the liver or the kidneys or the spleen. It may just be for muscle ache or for joint ache, and the principle is very much the same for different kinds of problems that we're perceiving. And it's basically that as a therapist, I am tuning into the sense of flow and rhythms that are present in the body. And as a therapist, I have learned to perceive what does an open flow feel like. As a therapist, I learned to perceive how is the body's fluid expressing itself in health. And I can sense where that health is not being expressed. And the way I'm approaching the part is, I may take that part of the body physically in my hands, so if it's a wrist, I may hold the wrist. If it's a finger, I may hold the wrist, or any part of the body which may be in trouble. And I'm going to hold that part in addition to, other parts of the body. And I'm going to listen to the story of that part. And I'm going to listen to it in a very special way. I'm going to listen to it with the quality of being mindful, present, really receptive, non-judgmental. And I'm going to be working kind of like a mother, that's really tuned into her baby would do. I'm just going to listen to it and trust in its own ability to figure out what to do. And what's really surprising is that when you hold the body this way, you discover that it can open up without massage, without having to manipulate it. But you're going to start to feel in your hands that the body is sensing through your hands the kind of presence that you're giving it. It's sensing your energy, and your therapist energy is an open, receptive energy, and the part of the body you're working with is a closed and contracted energy. So as you're touching it this way, if you give it enough time, so you work slowly and with somehow a connection to stillness, the body is going to express its pain in a very physical way. It'll come out as heat, as tingling, as vibrations, as all kinds of inner sensations that will release the story. And as a result, that body part is going to feel like it's connected to the rest of the body again, and you're going to start to feel that the fluid now is able to come in that area, and it's able to go through it in a much smoother way. So the principle is the same, working with whatever part of the body. But of course, in the craniosacral trainings, the therapist learns about the different body types and different ways to touch them, and the different kinds of things that you may find in different body parts. So this is the general idea, but in craniosacral therapy we have a kind of way of working that's a little bit different for all the body parts. Mm-hmm. The principles are the same.
Yeah, I think this therapy is really helpful to people.
Yeah.
So I want to know, how popular is it in West now, and how is it used there?
Yeah, that's interesting. So how, in what kind of fields, I guess that's what you're interested in, what kind of fields do we use it in, what professional use it in, and then what's the extent of its use in the West? Over the years, I've had many students also that have been doctors, and doctors are finding that craniosacral therapy can help them both in preparation for an operation, which can be an inner preparation, so getting the client more serene and more centered and more open to receiving the operation, but also in the post-operation. So I've had some students working as an anesthesiologist, working on the effects of the operation, and trying to reduce the effects of the stress and the trauma which happens during a natural, during a surgery. I mean, if you think about it, a surgery is a programmed trauma. So the fact that you are unconscious perhaps doesn't mean that your body doesn't feel it. Your mind doesn't feel it, but to some degree it is actually a stress and a trauma to the body, and it has the same effects as stress and trauma that may happen to you consciously. So we're finding that patients that are recovering from operations, like cancer patients, will improve and will have much better results of standard medical treatment by receiving and integrating craniosacral therapy as a part of their recovery. And I think also a part of it, which is a growing branch, is that craniosacral therapy is being used by people in the field of mindfulness and meditation. So we have it as a support to meditation practice. Some yoga teachers are beginning to use this, in addition to counselors, as I was saying before. And there's a growing interest in the fields also of beauty care. And I think it's a wonderful thing. I mean, the purpose perhaps is different, but the result of the craniosacral therapy is that one will express greater health. And as a result of greater health, of course, it will work on longevity, but it will also it will change your look. I mean, it's inevitable that if you're feeling happy, if you're feeling well inside of yourself, it's going to have an effect on your beauty. So, there's different kinds of fields, going from extremely professional to extremely relaxed fields that benefit from craniosacral therapy. And in the West, I mean, it's a growing discipline. So there's more and more interest in the U.S. and Italy, in Spain and France, all over the north of Europe, and the craniosacral therapy is really becoming very popular in the West. And my hope is to be able to bring this to China and bring the benefits of it to China, and help to train craniosacral professionals so that the Chinese people may benefit from this wonderful therapy.
Yeah, I think craniosacral therapy is really beneficial for people in the West and also for Chinese people.
Yeah, I could really see that.
Yeah, and how to be a craniosacral therapist, especially in China. I know you have many workshops and craniosacral professional classes in China. So can you talk about that?
Yes, I'd be happy to. So I'll tell you a little bit more about the type of trainings that I'm giving here in China. Well, here in China, I'm promoting the craniosacral therapy in different ways. I mean, over the past years, I've come here in China and I've been giving private sessions to people. So I have many people that I've had the pleasure to meet and to help with their own histories. I've been coming here for 4 years, and my clients keep asking to see me every time I come back. So, I think that says something good about the craniosacral therapy, and I've been trying to let the Chinese people know about this therapy, both through my work as a therapist and also through running workshops. So, for the first 2 years, I've been really interested in doing general open workshops so that people could get a taste for what craniosacral therapy is, so that people could feel what it is like to be in a craniosacral environment and being in a craniosacral presence. And Zhuhai has been really wonderful organizing the space and organizing the groups for that to happen. And I think in a way the work that is being done here in Zhuhai is a wonderful work that is really promoting a new culture for China. It's really integrating the culture for China with wisdom and knowledge from teachers in the West. So, I really appreciate what they have been doing with the coaching, what they've been doing with the Gestalt trainings, thanks to Rose, and what they've been doing also in their work with family constellations. I mean, this has proven to bring relief to so many people. I mean, I've met so many happy people and students here in Zhuhai and at the training courses that genuinely talk about life-changing experiences. And I think many of these students and people from the general public are noticing this. They're noticing that this work changes people's lives. This work actually changes the quality with which you live. And of course, I mean, we could sell an idea for a couple of months, but people soon would discover that it has no effect, and so it would die out. But Zhuhai has been working for more than 4 years now, 4 or 5 years now, and it's clear that the work that we're doing is extremely beneficial. I mean, people's lives are really changing and flourishing and benefiting from this type of work. Finally, this year, for the first time, I've started a professional craniosacral training. So, whereas before I was doing really more open to the public workshops, now I have started a professional training. And what that means is over a 2-year period of time, we're having about 40 days of class. It's divided in about 8 workshops over a 2-year period of time. And that curriculum, the teaching training curriculum, is in line and meets the standards of the international community of craniosacral therapy. So if you come to Italy, our training would roughly be around 40 days, and if you're going to England, the trainings are roughly 40 days. So between maybe 40 and 50 days trainings, and it'll be the same in the US, it'll be the same in Canada, it'll be the same in Northern Europe. The type of training that I'm offering here is a training to become a licensed professional therapist, and I think that you will be able to take that skill and that ability anywhere in the world. So what I'm saying is that it's what we're proposing here in China is part of a method that has proven to work and that we've been using for decades with great success everywhere else in the world. It's a very structured program. So what I'm doing here is very similar to that which I'm doing in other countries, over in the West. And I think a big part of the training is about the healing process of the therapist first. So even in the West, a lot of people are coming first and foremost to have a healing experience, not so much to become a craniosacral therapist. Actually, I think maybe 50% of the people coming to courses actually then use craniosacral therapy as a profession. I think most of the people that come nowadays come to have a healing experience. And they know that in the process they can also learn the skill to share it with other people, which is wonderful, even if you just use it with your family members, your friends, or your children. But the work that we're doing in class is first and foremost a healing work. I think a lot of people are also coming to these trainings in the best state of mind, which is the state of mind of recognizing one's own need to learn. And some people discover along the process that they really enjoy doing this and they really want to do this as a work. And other people, as a part of the training, connect to their deeper needs and their deeper priorities in life, and they may have life-changing experiences. And a part of that life change may very well be that they don't become a craniosacral therapist, but they become something else, like an artist, or maybe they want to help with children, or maybe they want to help with moms giving birth, and so on. So I think the reasons for coming to the training are very very diverse, but what we're giving as a result of the training is the ability and the skill to work in a good enough and effective enough way so that you can really help people's health improve, lives improve, and relationships improve.
Yeah, I know you are running some workshops and a professional craniosacral class in China, and you really have a plan about the next year's class in China. So how do you feel about that now?
Well, it's been actually for me it's been a great success to be able to start the first professional training here. I mean, we in the class we're about 30 people in class, and I feel that the quality of students that have come is really great, and we're almost finished with the first year of the training, and I can really see how the students' lives are beginning to be affected by learning the craniosacral therapy. So it's not just the information they're receiving. And for me, it's always really exciting. This stage is really exciting because the students don't really know what's happening with them yet, and some of them they can feel the greatness of what's being explored, but they don't really know where all of this is going. And for me, it's really exciting because I find myself in this situation many times with hundreds of people, and I just I can really feel the love and the beauty of this first generation of Chinese craniosacral therapists, becoming professional. And so I very much look forward to completing this training, and for people to receive it from their own Chinese people. And I'm coming next year, starting in March and in June, for the new class of craniosacral therapists. So my hope is that more people will understand the value of the craniosacral therapy, maybe will come to the class as a way to enjoy this training and the benefits that it has.
Thank you very much. Thank you for joining us to this interview. And I sincerely hope more and more people can know this therapy and benefit from you. Thank you for your efforts in bringing this new ideology to China. Thank you.
Thank you, Walter. It's been a pleasure sharing today with you, and I've been really happy to spend this time with you talking about craniosacral therapy. I thank the viewers for watching this.